I have a long history of experience in home visiting programs, 8 years as a home visitor at the very beginning of my career when I knew nothing but thought I knew everything. And then since then, about 20 years of experience providing training to home visitors and 15 years doing program evaluation of home visiting programs and 15 years developing measures for home visiting programs and practice. The key questions that are part of my presentation today are, first, is a home visiting program implemented correctly? And that is just correctly in terms of that program's design and goals. Are the intended outcomes achieved? And are the principles and processes parallel at the family and the program levels? And these are all questions that have been mentioned in other talks yesterday and today. This is a very simple logic model for the home visiting work that I do in collaboration with my colleagues, including Mark Innocenti, who spoke yesterday. And it's a simple model in which home visiting is intended to support parenting that supports positive child development. We define that kind of parenting as developmental parenting, which has several meanings. One is that it is the kind of parenting behavior that supports children's early development, that it is parenting that changes and adapts as children grow and develop, and it is also behavior that can be developed. We also use the term developmental parenting as a phrase to characterize the approach to home visiting that we've been developing and working on for many years. And that approach has these and other characteristics, but these are the primary characteristics. One is that it is very much based on parenting strengths. No matter what challenges the parent faces, we focus on what they can do and are doing with their child that is positive. It is guided by observation and feedback, and it can be adapted to the individual family in their culture and in their circumstances. This is just an example of this model tested in some of our research. This is an evaluation project that I did of one early Head Start home visiting program in the United States, in the Western United States. And this is just one of the impacts that program had, which is that it had an impact on reducing parents' use of physical punishment, and it also had an impact on less aggression in the children. And statistically, we find that the impact on lower aggression in children is mediated through the impact of less physical punishment. So just like our model implies, it's a two-step process. First, the program helps parents use less physical punishment, and then we see an outcome in the children of less aggression. For any program of any kind, but particularly home visiting programs, a clear logic model helps train and supervise home visitors so that they have a clear idea of not only the goals of the program, but also the process that is expected for how we get those goals, how we achieve those goals. A clear logic model helps the program monitor the home visiting process fidelity to see that the process we think is supposed to be happening actually is happening in home visits. It helps guide the measurement of program outcomes, and then by providing feedback from that data, helps programs improve their process and their outcomes, and therefore continually improve their programs. So that's the first recommendation I have for any program, that if they have not already very clearly drawn a graphic model of their program, that's a good place to start to make sure everybody has the same picture of how the program is supposed to work. So these are the questions that we ask programs when we're helping them develop a logic model, which is, what are the child outcomes that are the most important for your program? How is it that you believe parents support those outcomes? Which home visiting strategies are you going to use to help parents do more of that? And then what can help or get in the way of those strategies being effective? So for us in our work, these are the most important child outcomes: the social emotional domain that includes attachment security, self-regulation, and acceptable behavior. Our second major domain is language, the child's emerging ability to communicate, their growing vocabulary, and their literacy skills, their emerging literacy skills. And then the cognitive domain of child learning, exploration, and problem solving. I have put in small letters at the bottom of this box that also in these outcomes, many programs are focused on health, which is what we've heard here, safety, motor skills. We don't emphasize those only because the programs that we work with are more concerned about the social, emotional, language, and cognitive, but many logic models could have other things in this child outcomes box. These are the parenting outcomes that we have focused on, primarily from our review of the literature, our own research, and our work with programs. We are emphasizing 4 aspects of parenting. First, affection, the warmth, closeness, and positive emotions parents express with their children in many ways. Responsiveness, the parent's response to the child's cues and communication. Encouragement, the parent's support of the child's interests and efforts. And finally, teaching, the conversation and play and cognitive stimulation parents provide for children. Parents vary and do some of these things more than others. Every parent may have a different profile, but all of these kinds of parenting behaviors support child development. Again, I've listed some things that we don't focus on as much, but some of your programs may. The physical caregiving, getting children to a doctor, feeding them well, helping them sleep, injury prevention, and discipline. However, we do believe that the other domains of parenting, when those are strong, often support these other aspects of parenting as well. We focus on these because they are easier to observe more often in everyday observations of parents interacting with their children. These are the important home visiting strategies that we emphasize, and we emphasize 4 basic strategies plus family engagement. And the first one you've heard over and over again in this seminar, the relationship between the home visitor and the parent. So the home visitor establishes, sorry, these keep skipping ahead before I'm ready. The home visitor establishes warmth, respect, and acceptance with the family. That includes trust. That includes some mutual understanding. The second major area is responsiveness to the family strengths. And by that we mean both looking at what the parent is already doing that is good for their child, and every parent does at least something that is good for their child. Responsiveness to what the family has, the resources they have in their home, what they already do with their children, what interactions they already have. So we do not emphasize taking in a bunch of stuff, a big bag of toys or books or anything. We don't emphasize that, although we work with many programs that do that. We also think of family strengths in terms of who is in the family, fathers, grandmothers, other siblings, anyone else who is there. We consider an opportunity of resources for that child's development and support for that child's development, and we respond to the strengths that are there in the family in the form of people and things and parenting behaviors. The third thing is a key part of our approach, which is helping the parent and child engage together in positive ways. The fourth thing is planning with the parent with a focus on the child so that at every home visit there's a conversation about the next home visit and how we will spend that time, what kinds of things the parent could be doing with her child during that home visit. So there's very much a partnership, not an expert teaching someone who doesn't know what to do, but a partnership of collaborators who are working together on finding ways to support this child's development. The final piece that makes home visiting work is the engagement with the family when both the parent and the child interact with the home visitor and the activities that are part of the home visit. So this is our simple logic model for most of the work that we are doing, and it would be different for different programs, but this lists those home visiting strategies, the developmental parenting domains we emphasize, and the child development domains we emphasize. And one of the things that I want to point out is that we consider this model valid even in the most difficult and impoverished circumstances in which families find themselves. This is a photograph of a parent who is in the New Orleans airport after Hurricane Katrina and devastated, has nothing, and is still finding a moment for positive engagement with her child. We believe that to monitor and evaluate home visiting effectively, you have to measure each part regularly. We emphasize family-friendly child development measures that are easy to understand, easy to use, that work well in families' homes, that are appropriate for a wide range of development and can involve parents and are still reliable and valid. There are lots of advantages for involving parents in those measures, but basically it helps them understand their own child's development and become more realistic about what the child can do, be better observers of the child's play and activities so they can keep the child more safe and better support the child's development. These are just a list of some child development measures we have found to be family-friendly. Parenting measures, there are actually many parenting measures. We emphasize observational measures, but many of those that are available in the field measure very small behaviors with detailed frequency and duration measures that take a long time to learn and a long time to code from a video recorded observation. So we developed a different measure called Piccolo that was developed for home visitors to use because it would be easier, more useful, and still be reliable and valid. We based it on 4,500 observations. We used 40 student coders who did not get very much training, and we selected the 29 best items. This is what it looks like. It has 4 domains, those 4 domains I mentioned before, of affection, responsiveness, encouragement, and teaching. And each domain has items, behaviors, and then a definition of that behavior that the home visitor can use. In this case, speaks in a warm tone of voice, smiles at the child. So what does a parenting measure tell you about parenting? It tells you what a parent can do, what they believe is important, what their values are, what a parent is comfortable doing in front of someone else, and what they know how to do with their child. So that is the best place for a responsive home visitor to begin her work and to emphasize those behaviors in the home visiting activities. These strengths that parents have depend very much on their circumstances, their experience, their culture, and their mental health, but all of these domains support development. So we focus on what the parents do most as their strengths, and we don't worry about the rest. It will come. Trust me. These are just some other parenting measures that we found to be useful, and you can look them up later. We've also developed a home visiting measure to observe intended practices that's based on our theory of change. It's based on what happens when a visit is effective. We developed this measure by asking home visitors what works. We measure both the strategies and family engagement, as I said before, and these are the scales: the relationship with the family, responsiveness to the family, facilitation of parent-child interaction, the most important one, and non-intrusiveness or collaboration. And then finally, the family engagement is both the parent and child interaction and both of their engagement in the home visit. This is what an effective home visit looks like. Basically, we don't want home visitors coming between the parent and the child. So we don't want home visitors to try and show the right way to interact with a child, because especially for young, poor, or stressed or depressed mothers, it can be very discouraging to watch someone who's very good with children be very good with their child. Secondly, we also discourage too much focus on the mother and the family problems because it takes the mother's attention away from this developing child who will go on developing no matter what problems this family faces and needs support for that development. This is just an example of some things we look for in a good home visit. This is one of the rating scales, the facilitation of interaction. The home visitor facilitates at least some interaction, observes interaction, and gives feedback about what works, not what's missing. Comments on the child's cues for interaction, prompts the parent to engage in interaction with the child, and brings materials or activities that promote parent-child interaction. So these strategies do work. We've tested them in 2 different home visiting programs and seen that those strategies, when they are in use, predict better quality home environment and better child vocabulary at the end of the program. Observation is sometimes difficult for programs to do. We've also identified, we've been working on, it's still in progress, a self-report measure that lists both red flags, these are signs of ineffective practices, the parent leaves the room, the child races to greet the home visitor and look through her bag of things because that's what the child sees as where the fun comes from. There's more time on family problems than child development. Not much gets done when the other family members are home, and the parent says, "Oh, you are so good with children," which, when I was a home visitor, I thought that was really good. It's not. It means the parent is feeling like they are not so good as this wonderful person their child enjoys so much. So it's a red flag. We've also identified the opposite, the green flags. Things are going well. The parent and child are interacting during most of the home visit. The child is excited and turns to the parent when the home visitor gets there because the child knows, I'm going to get my mom's attention and it's going to be fun. The home visitor comments on positive interactions that are observed during the home visit, and other family members are involved and engaged whenever they can be. You know about the exceptions. And the parent says, we enjoy doing these things together, that's the kind of feedback you're getting. Not that you are so good with the child, but that they are enjoying these things they do during home visits. This is the self-report measure, but I'll skip that. And I want to touch on one more thing, which is the piece before we begin the home visiting strategies is the training and supervision. You've heard that emphasized by other people, and it's critical, and it should be similar to the kinds of support we want home visitors to provide to parents. We want supervisors to provide to home visitors. We want it to support the home visitors' development. We want it to change with the home visitors' development, and we want it to use an approach that's based on the home visitors' strengths and the community's strengths, that's guided by observation and feedback, that's adapted to the individual home visitor and program in the community it's in, and is aligned with the program's logic model. There are many things that can help or hinder along the way during any one of these steps. And here's a list of some of them. If you don't have enough time, if there are other competing influences, environmental stress, health and mental health problems, abilities and disabilities, a lack of support for change, that can all get in the way, but the opposite of those things help make it work. Providing the time, additional positive influences and supports, finding ways to reduce stress, increase health and mental health, increase abilities, and providing a supportive culture in the program for change. So these were the key ideas. For program fidelity, you need a good logic model and to measure those home visiting strategies. To get your intended outcomes, use family-friendly child measures and also a good parenting measure that helps home